Welcome back. This week we saw the first candidate announce that she is jumping into the race to replace Dane County Executive Joe Parisi. Regina Vidaver sits on Madison's Common Council representing a district on the city's near west side. She also works at the Department of Health Services, overseeing chronic disease and cancer prevention programs. We spoke with her earlier this week at her home in Madison. I was curious with politicians to get a sense of why you decided to run. Was there a specific moment that you decided to step up and run for county executive here?
Oh wow! Now you're getting into my psyche. I am and strive to continue to be a servant leader, and I have really devoted my entire career to service, spending the last 25 years in health-related fields and in management. And I reached a point, I joined the Emerge Wisconsin class of 2017 and was really interested in moving into an opportunity to learn how to run for office, and feeling that that was an opportunity for a way for me to continue to give back to my community. In 2017, when I did Emerge, they said, identify the position that you want, and this was actually it. And it's because I've spent my career in management and executive spaces, and so this is a role that's appropriate for me to play, given my experience and the work that I've done in my life. This is the area where I chose to raise my family because of the attributes and amenities that are here. You know, from the lakes and the universities to our focus on agriculture and healthcare, and our incredible engagement with keeping our environment clean and available for our next generation. And that's really what drives me to want to be here. And I really want to create a place where everyone has the same kind of opportunity to thrive that I and my family have had. And that's really what I want to bring to the table.
Is there something specific about the county level? Because I know county obviously handles different mechanisms than city, for example, like public health, perhaps.
Yes. So at the county level, it's about 40% of the budget is health and human services, which is where I've spent my career. And again, I've been in executive position. I ran a nonprofit organization in lung cancer research and advocacy, and that allowed me to really understand all of the elements that are required for an entire enterprise, from finance and HR and communications and program management, all of the things that a county does. In my role at the Division of Public Health for the state of Wisconsin, I've been there 6 years. And there it's a large entity with multi-tiered management, much like the county. And so the ability to really look across and take a systems level approach to things is really attractive to me, and a place where I think I can really bring value to the county. At the city level, things are slightly different than the county level. Certainly the public health is shared between the city and the county, and so it's a place where there is a lot of interaction, more so than in some other places where there is shared interest. But there it's a actual connected agency between the two.
Curious a little bit about your experience too, both in public health and then also on the city council level. What do you hope to take to the county executive position from your experience so far?
Yeah, so really this service mentality, and Dane County really is a place where there are services provided, and what we've seen in the data is that there's just too many people who are still struggling, and Dane County really needs to be that place that provides outstanding services to the people who need them most. And I'll give you an example. A constituent contacted me who, her mother was elderly and needing to move out of her home because of mobility and the conditions of the home, but her mom didn't have a lot of money. And so she really needed an affordable space. And she went to all the websites, all the emails, all the phone calls, and this was somebody who had the time and the educational background to do this, and she still struggled. And so she wound up contacting me to see if I could help, and it just turns out we have an affordable housing complex coming up down the road, and I was able to connect her to the developer, and remarkably, there was a space for her mom. So it did work out in the end, but you shouldn't have to connect with your elected official to try to get the services you need. It's really important that we identify how we can really commit to change and collaborating in coming together across our community organizations, our health systems, our educational institutions, and our cities, villages, and towns to really bring that collective impact to the fore.
So you might have actually just touched on it, but I'm curious from your perspective, what some of the biggest issues that face Dane County are? What would your first 100 days look like, for example?
Yeah, so we certainly have some pretty significant issues in housing, and I do think that Madison is leading the way in some of the approaches. Unfortunately, the legislature has done things that have really removed a lot of options from local municipalities to be able to do things that are right for their communities. And so there are creative approaches, and I think that what Madison has been able to do in terms of offering carrots to developers to add affordable housing are things that can be implemented in other cities, villages, and towns. We definitely need to work on access to behavioral health care. It's a real issue around the county, and it's not going to be easy. We have the CARES initiative, which thanks to the county executive now, and the county board is about to vote on expanding it. It's still only going to get about 20 miles outside of Madison that the Madison Fire Department can accommodate. And so we really have to think more broadly about how do we do this on a regional basis so that we can really bring that type of service to the entire county.
And you're thinking more like kind of on the emergent basis, like what CARES would cover instead of Mendota or something like that?
Yes, exactly. So certainly we do need a crisis intervention center in the Madison area. We don't have one. The closest space is Winnebago, and that's really far away and really difficult. And it's concerning that a county with this size of a population does not have a site like that yet. And that is definitely going to be a high priority for me in this role.
So we've seen a little bit of contention on the county board level for the past couple of years, especially with Sheila Stubbs' the appointment to the Department of Human Services. If you face any kind of contention like that in your term as county exec, how would you handle that?
I think the first thing to think about is building relationships. So really engaging with county board members, engaging with community organizations, engaging with our leaders in our villages and towns and cities so that that relationship is there and that we can have productive conversations. It's never good when you create this us versus them sort of situation. We're all in this for the same thing. We all want to serve our communities. We might have differences of opinion about how we do that, but we're all coming from the same place. And so the more we can realize that and find the places where we can agree and find places to compromise. We don't always have to fully agree, we can compromise. And I know that sometimes seems hard from a political perspective, but it's what's necessary to get things done.
Parisi announced earlier this month that he would retire, and we're expecting a special election for early next year. We'll be right back after this.